Yeah, this is just a general recap about COVID for anybody who hasn't heard our spiel yet or has some continuing questions or whatnot. Basically, what we're talking about is COVID-19, which is the virus that was identified late last year and landed in the United States earlier this year. It's certainly a threat to the older population, especially those that are immunocompromised or have some other type of pre-existing medical condition. It's also a threat to some of the younger population, such as children and whatnot. Although the data isn't really clear just yet as to how it affects the younger generation or how much they carry it versus showing symptoms. When they do tend to have symptoms, they tend to be very dramatic and end up with inflammatory processes and those types of things, which can cause a lot of problems for kids. Certainly mainly, excuse me, certainly mainly spread through respiratory droplets. And that's why we're wearing face coverings and we're looking at the 6-foot separation. But you can also get it through secondary contact. So just like influenza or any of the other noroviruses that are out there, if you contact a doorknob, if you stick your hand in a bag of potato chips that somebody else has been eating, handrails, whatever the case may be, that's infected with one of those viruses, and then you touch your face, touch your eyes, nose, you can end up with contracting the virus through that way. So surface contact is still a concern for spread, which is why hand washing and whatnot is still out there. Not everybody that has COVID is showing symptoms. There are pre-symptomatic and there are also asymptomatic people out there. So you can have COVID virus that is spreadable. And CDC is suggesting that up to 60% of people who contract COVID virus get it from people who were either pre or asymptomatic through the process. Recently, CDC put out some information talking about, there's a low number of people that are actually asymptomatic. That number has been rolled back. So there's really still a lot of confusion and misunderstanding, I think, or lack of knowledge relating to exactly how prevalent asymptomatic people are and what their exact role is in the spread of the transmission. So right now, 60% about is the number CDC is leaning on, but that is always subject to change. So what they're continuing to tell us about protection from COVID, protecting ourselves, factors that can affect whether you get it or not, has been consistent since day one. And when I look at this, it's very similar to how we deal with hazardous materials or ideological or biological agents that we deal with in the hazmat world. When we look at time, distance, and shielding to help prevent contracting or being exposed to the virus. So distance, which is the 6-foot distance or more if you can get it, is certainly important. I'll jump down to the bottom, which is use of face coverings, certainly face coverings to limit the spread of droplets when you cough, sneeze, speak, are proving to be a worthwhile endeavor. So even the cloth face coverings, which are subject to scrutiny or are often talked down, do provide some level of protection. There's just no doubt about that. I think the middle bullet there, length of interaction, is particularly important to this council, especially when they're going to be making some decisions later on this evening. And length of interaction, typically with CDC, as it relates to COVID, is usually 15 minutes or more. So what that would indicate to somebody who's going to make a decision like you are later on is you have to look at the environment that you're working in or working with, the environments that you're looking to set policy for, and decide in those environments, is your length of interaction really going to be 15 minutes? Will it be 10 minutes? Will it be 5 minutes? I would put forward to the council to consider that if we were in an environment such as Old Orchard Beach or Portland's Old Port or something along those lines where crowds tend to congregate outside, or there are long lines to get into a particular facility or whatever, then I would expect that you may see wait times of 10 minutes, 15 minutes, or what have you. It's, it's not likely, based on the rule of length of interaction or time of exposure, if you will, that as we're walking by somebody on the street or passing on a sidewalk or what have you, that length of interaction is going to be enough, especially if you're outside, to contract the virus. I'm not saying it's impossible. I'm saying that understanding duration is an important consideration for you when you make this decision later on. So I think that's the big three there. So again, just the standard guidance that we have when we're talking about limiting spread of COVID. Number one is and has been wash your hands. Hand sanitizer of 60 to 70% alcohol if you're not able to wash your hands right away. And then as soon as you can, wash your hands. Warm water, soap. We want to bring the soap to a lather, and we want to wash for at least 20 seconds. And that's humming the happy birthday song twice to yourself, probably not out loud so people don't think you're crazy, just to make sure you've got the accurate or the correct duration of washing. Again, close contact, especially if they're people that are not in your household or what we would call a cohort. 6 feet of distance is a good guideline. Most droplets, most of the heavier droplets are going to drop within that time frame. You can still get a little overspray beyond that, but ideally the mask or whatever will help eliminate as much of that as possible. When we talk about cover your mouth or nose with a cloth or a cloth mask, face mask, whatever you have, again, that goes with that 6 feet. If you're not able to maintain 6 feet, that face covering is really essential to help limit that spread of virus. And again, it's not so much protecting yourself, it's protecting other people so that if you are an asymptomatic or pre-symptomatic carrier, you're not sending that out. Cough and cover your sneezes. What we're talking about is coughing or covering into the bend of your elbow. So even if you have a mask on, that extra layer of protection will certainly will help you a little bit further. And it's important if you're dealing with family members or stuff like that. Clean and disinfect frequently. You know, in the town office, we have policies that reflect what healthcare organizations are doing with frequency of cleaning and high contact areas and those types of things, the way we have separation and whatnot. So clean and disinfect, not only in your workspaces, but if you're at home, you have people over for whatever the reason is, even if it's family members outside your regular family unit, do a quick clean to start with, and when they leave, go ahead and do another quick clean. Not because they're dirty people or whatever, but the intention is to try to clean up all that aerosolized droplet material that may be coming out of your mouth or whatever the case may be. And then lastly, or one of the other things here is monitor your health daily. You want to pay attention to what's going on with you, how you're feeling. Are you developing symptoms that you don't normally have? Have you developed a cough? We talk about loss of smell and taste, but there's a whole host of other symptoms that have started that are also related to influenza, like fever and chills, nausea, vomiting, gastrointestinal issues, those types of things. As we're coming into flu season, which typically starts around October and will peak sometime around January, February area, there's going to be a lot of concern as to whether or not people have influenza or do they have COVID. So being attentive to what's going on with you and not ignoring those symptoms is really, really important. Some additional steps that you can do to help prevent you from either contracting corona or influenza or one of the other noroviruses. At the end of the day, they're all viruses, and these all apply across the board. Number one is drink water, or drink flavored water, or whatever it is that you happen to have. The idea behind that is water's important. We know that we're mostly made up of water. Water is essential for cellular function. It's essential to maintain cognition. It's essential to flush wastes out of our body. So when our body is attacking that virus, it has to go somewhere. And part of that excretion is through water when we urinate. So drinking water is very critical. 2 liters a day would be ideal. A gallon a day would be great, but whatever you can get into you is really important. Second thing, when you're dealing with this stuff, especially this time of year, getting on some type of regular sleep cycle is critical. Your body needs time to heal. It needs time to work. Having rest will help reduce stress. And we'll talk about stress in just a minute, but trying to establish some type of healthy rest cycle, especially with everything that's going on with coronavirus, the disruption in the nation and the political atmosphere, everything else, getting on some type of regular rest is really important. Eating healthy, again, you've heard this on and on and on about eating healthy, making sure you're getting enough calories, but you have to also make sure you're getting the right kind of macros like vitamins and all those types of things. Don't let non-COVID illnesses linger. You need to make sure that you are you're taking care of yourself. Whatever you have now, if you get something else, it's just going to make it worse because your body's already fighting something. Take time for yourself. World Health Organization just put an article out yesterday that talked about the infodemic, and what they're relating to is the fact that there's so much disinformation, misinformation out there that they are fighting against that as well. So don't fall victim to those types of things. Take a break, take a rest from the news, take a rest from all the negativity, relax, find some time for yourself to kind of heal yourself and ground yourself. Last thing is use a humidifier in your home, especially when things are starting to dry out. You want to make sure that things are humid. It helps your body heal. It'll help you repair things that are going on inside. So those are some additional steps that you can take.